Well, good afternoon, friends. Thank you for joining in today on another episode of Unbreakable Health. I feel like we are at this place in time and in history where we have access to so much information, yet we haven't always been attuned with our own bodies and in tune with what it means to be stewards over our own health. That at Unbreakable Health, we make it our mission to give you back your power so that you can make decisions around your health and so that you have the ability to be the steward over your healthcare. But it takes connection, it takes education and true awareness. And today, I am very excited to dig into this conversation specifically about women's hormones with my friend, Dr. Omar Akhter out of Cedar Park, Texas. This is not his first time on the Unbreakable Health Talk Show, but we are going to dig in a little bit deeper because let me tell you what, since I had him on last time, I think I might have had a little hormone adjustment. So let's dig into this conversation and welcome Dr. Akhter.
Thank you. Thank you so much for having me.
You're so welcome. So he made the drive all the way from Cedar Park, Texas. We're like on two different sides of Williamson County. But I'm excited about this conversation today. And I think you're going to be able to provide some great insight for both women and men. Because you know what? When women's hormones are out of whack, the men feel it too, don't they?
Absolutely. The whole family feels it.
The whole family feels it. Well, please take a moment and introduce yourself, and then we're going to dig in.
Sure. My name is Dr. Omar Akhter. I'm an internal medicine physician. I have a private practice in Cedar Park, like you mentioned. In my private practice, I really deal with female hormones quite a bit, in addition to a wide array of other things as well. And I've been doing that for this is my 7th year now, so it's really exciting. But yeah, I'm just out there really just trying to maximize patients' access to really good healthcare in this very, very difficult society that we live in as far as healthcare goes. So really trying to do the best I can in that regard, and excited to be talking to you again today.
Awesome. Thank you. I will say, since our last conversation, I've had several friends that say, hey, can you send me that interview again? So I hope that has brought you some great connections because everybody loved your talk last time.
I appreciate it.
Absolutely. Well, today I want to talk a little bit about you said the world that we're in and the medical place that we're in. But talk to us a little bit first about what are some of these signs that we're dealing with as women. Okay, so I'm I don't want to say mid-age because I'm believing for 120 years here, but I'm at that stage, and a lot of my viewers and my friends are at that stage where we're starting to see some adjustments in our bodies, and maybe forgetting a little bit about why we walked to the kitchen halfway through the day. Tell us a little bit about what happens to women as we go through some aging cycles.
Well, I'm very happy that there's more awareness being created in the world out there about female hormones. There's a lot of talk, amongst the big celebrities and things, in trying to create awareness for women to understand what's going on. I think we live now in this social media age, so there is a real hunger for information, especially for this. And so that part is really good. It's very encouraging to have that. But, there is this entity called perimenopause, right? Perimenopause is a term that unfortunately does not get understood very well, but it's an important term that women, when they get into their late 30s and even early 40s, are going to start experiencing hormone changes, primarily the reduction of progesterone and a very erratic estrogen that starts to go up and down. And that is going to cause them a whole host of symptoms. Now, I think that we often mistake it to be there has to be something only with your cycles, right? So if there is hormone imbalance with cycles being irregular or something like that, that is considered to be quintessentially what perimenopause is. But what's important is that perimenopause can include so many other things that don't get talked about. And I think the first and foremost is women just don't feel like themselves, right? So you just can't really put your finger on it. You just don't feel quite like yourself, like how you used to. And that's a very subtle sign and symptom of perimenopause, but indeed it's a very important one. But you mentioned brain fog. So you can have brain fog, you can have fatigue, you can have low libido, right? And so differences in issues in sexual function, libido, vaginal dryness, right? Hot flashes, night sweats. And those are sometimes hot flashes and night sweats are thought of as more easy to pinpoint as hormone symptoms, right? Whereas a brain fog as a symptom, you often don't think of that being a perimenopause or a hormone symptom, right? You just you think something is off. I don't understand. Is it a neurological thing? Is am I suffering from a big illness or something like that? I just don't feel like myself. Is this dementia, right?
Oh,
Um,
yeah.
so these are the thoughts that come into the mind of women, and just in this age. And so I think that awareness about the symptoms is really important, that these can all be due to perimenopause.
Wow. Well, thank you for sharing that, and especially that age marker, of course.
Mhm,
And can you talk to us a little bit? Is that age coming
mhm.
like earlier now than it used to? Or are we
Yeah.
is it just because I'm in that age that I'm aware of it?
I think to some degree it could be coming in earlier. I think that it's mostly related to awareness. I think that when previously maybe women thought that this was just part and parcel of getting older,
Mm.
and a lot of these symptoms, as you know, get dismissed by the physician, right? The physician is just saying, "Oh, you're tired because you have 3 kids and you're busy, a busy working mom, and you're getting older," right? Whereas I think that there is now a real understanding that perimenopause can affect you as early as your late 30s, or even, I mean, mid 30s, but like let's say late 30s,
Mhm.
definitely.
Mm.
And with that awareness is the understanding that if it's happening 7 or 10 years before menopause, then really you want to be aware of these symptoms right when you're crossing that 40-year mark.
Mm. I think there's definitely a beautiful piece of having awareness, right?
Hmm.
Because knowledge is power. But having the awareness doesn't necessarily change the symptoms. So, what
Hmm.
are some
Yeah.
things that we can do when we start
Hmm.
recognizing those symptoms? Obviously, we can come in and we can visit with a practitioner like
Yeah.
yourself and test some things, but
Yeah.
talk to us a little bit about treatments for that because
Hmm.
I know that we don't want to just say, okay, this is what I have and I
Hmm.
just deal with it,
Right,
right?
right. So the first step I always say is about awareness, and right. And I think in the world of medicine, when you deal with a lot of patients, the first thing that people do is often deny their symptoms,
Mm.
right? And women, when it comes to this, have often been unfortunately dismissed so much that they start thinking that they themselves are going crazy,
Oh,
right? Where if the physician tells you enough times that there's nothing wrong, I look at the blood work and there's absolutely nothing wrong with you, then you start to question yourself and you start to wonder that these symptoms that I'm having, are they really, like, am I really having them, or am I just going crazy, right?
sure, sure.
And that's a very unfortunate part of how sometimes our medical world deals with these issues. The medical world is geared towards dealing with something that is very easy to identify and take care of. Think of a lesion on a colonoscopy or something. Very easy to go in, do something about, and just take
Remove it.
care of the
Yeah.
situation, remove it, right? Or a breast lump. You have a breast lump and it's just taken out. But when you have subtle symptoms that might be due to inflammation, brain fog, and fatigue that is unexplained, um, a lot of times those symptoms, if the physician or the provider, whoever it is, cannot understand it, then it gets dismissed. You
Mhm,
see?
mhm.
And so to go back to your question, the first part of that is really the awareness that something is going on, and I do need to seek help for it in some way. Now, that doesn't mean you have to go right away to a practitioner, but it might just mean you stop and kind of reflect on where you are in your life and focus on the foundational things that we can talk about. But, the diet, lifestyle, that part of it, that has to be really addressed first. And so the first thing is just awareness that, listen, I am getting older. I probably can't do the same things that I used to do, the same way that my body compensates and recovers. So I do really need to take a step back and really assess my symptoms and say that a change needs to be made,
Mm.
whether that change is a dietary change or lifestyle, or to actually make a change and go see a provider. There has to be that awareness first.
Yeah, absolutely. Well, for sure, this is a beautiful piece of this conversation right here is the awareness, right? We
Mhm.
can we can now put a name to something
Yeah.
that maybe we didn't have a name for before, right? And so, okay, so let's say maybe we don't recognize it because here's one of the things. I feel like our body gives us all kinds
Mhm.
of signs.
Yes.
Like, and it's trying to communicate with us all the time, like, stop that,
Mhm.
calm down, all those things. But I feel like there's a whole lot of external noises that are
Mhm.
happening. And so we don't always understand or hear those symptoms or
Mhm.
those signs or those
Right.
signals. One of the things that we talk about a lot is nutrition.
Mhm.
And, if maybe we're dealing with brain fog or coffee addiction,
Mhm.
we may not realize that there's something else going on hormonally because we think it's the aftermath of the coffee. So, talk to us a little bit
Mhm.
about those key foundational pieces
Yes.
that you share with people.
So I always tell patients when I'm seeing them that the foundation of your health is always going to be diet and lifestyle, and right. And so the four pillars that stands on is nutrition, which is the diet part, and then it's stress, movement, and sleep. Those are the
Mm,
other three components. These four, for me, form the foundations. If you can get these right, a lot of times most of the symptoms that you're struggling with, or several of them at least, can get better for
mm,
sure.
mhm.
And nutrition is an important piece of that, because if you're not eating a good diet, which is healthy in more whole foods as much as possible, less of the processed foods and the foods with chemicals and all of these things that we have, then a lot of times you're going to be struggling with so much inflammation in your body, whether that manifests itself in gut symptoms, or like brain fog is oftentimes a brain inflammation symptom, right?
Right, right.
And so if it's brain inflammation that you have, then brain fog is how you're presenting. And that could have a nutrition root, right? We talk about root causes. And so that can be related to nutrition. And so trying to clean up the diet is really, really important first. And so we're just focusing on those fundamentals. Then you can dig deeper, working with a practitioner, oftentimes to go, let's say, gluten free, dairy free, to implement more of an elimination diet,
Mhm.
which is to remove the inflammatory foods in your diet, and to see if any of your symptoms are related to that.
Right.
So that's really a nutrition foundation. Um, the rest of it, as I mentioned, the sleep, the stress, and the movement part, those three are also incredibly important, right? So
Mm,
we're never going to be very healthy if we're just sedentary and sitting most of the day, which unfortunately, in this kind of work from home culture that we have now, that's the case for most people.
right.
And so we have to now purposely move, because our lives are geared around convenience. You got the Amazon Prime, and you got the delivery, and so
Yeah.
everything is geared around convenience, which means that the amount of movement that people are doing is much, much less. Of course, stress, you don't need me to tell you about stress, which is that we're all living in a heightened state of stress.
Right.
Whether that might be due to your stress in your immediate vicinity in your household, or stress just because of world events and national things. But no doubt we're at a very high in terms of stress levels. And I think it's up to each person to figure out what works best for them in mitigating that stress. But we can measure these things to say that how your stress impacts your physical health. And then sleep is the same thing, where if you, for example, if you stay up a night, then that actually has significant impact on your immune system, where it actually suppresses your immune system. So now the next day you're more prone to catching a cold and immune suppression related symptoms. So it's all that to say is that if we don't have these foundations taken care of, then oftentimes we can't even go to the next step, which is to then assess hormones and other balance in the body.
I think that's your foundation is fantastic. And I think about, how many people would say, oh, that's so hard. Like,
Yeah.
it's so hard to in today's fast-paced world to find the food, right?
Right.
And so what are some, and I'm a big believer that nutrition has to be number
Mhm.
one, and that they all play off of each other, right? A lot of times
Yes.
the food that we eat manifests in more stress, and then the
Mhm.
lack of sleep, and it just is a whole
Yeah.
cycle that can work
And it
for or
connects with the
against.
hormones too, in the sense that you need good gut bacteria in order for your hormones to work effectively. And so that's talking about, like, when you talk about estrogen, progesterone, and these hormones, even thyroid, right? You need a good, healthy internal environment for them to be effective. So
Mm.
when you say feed off each other, that's exactly what we're referring to. That nutrition forms that basis.
Yeah, and so traditionally, I've seen a lot of people that will go into HRT,
Mhm.
and and they'll just look for different types of treatments or therapies or medications to kind of cure
Yeah.
situations. But you're right. So
Mhm.
talk to us, like, if we don't deal with the foundation
Mhm.
first, then
Mhm.
we're not, it's counterintuitive or potentially a
Yes.
waste of money. But talk to me a little bit
Yeah.
about how you
Mhm.
guide people
Mhm.
through that journey.
When I'm seeing patients, I'm always focused initially on where they are in their health journey and where they are in these foundations, right? Because patients come in various different places in their journey, rather. And some patients are at this place where they're very, very unhealthy in their lifestyle. Just the foundational things that we just talked about. They're eating poorly, they're not sleeping well, they're highly stressed, and they're not moving.
Mhm.
And those are the patients that we have to have a more of a foundational focus on as far as those things go. Then there are patients that are actually coming to us and they're in a pretty good health. They say, I eat well, I eat very clean. I sometimes they're even in the medical field, and they're not stressed, they're sleeping well, so they've taken care of the foundations, right?
Mhm.
And those are the patients that will often need a little bit more. That's where the discussion around hormone replacement therapy or HRT comes in. So with them, we're jumping to blood work, although we're doing blood work on everyone. But
Sure.
for them, it's okay. The foundations are taken care of. Now we want to look at your blood markers. What is your vitamin D levels? What is your iron? What is your thyroid and other hormones?
Mhm.
And then we want to create a plan, particularly around hormone replacement therapy too, if it's warranted. Um, I can share an interesting story with you on that, which is that, I had a middle or like 40, mid 40s lady come to me. And, she is herself a health coach. So she was very healthy to begin with, and she's doing everything right. And she had severe symptoms of mood swings. So, like almost to the point of rage, right?
Mm, mm.
She had hot flashes, night sweats. She had some GI symptoms, like really anything you can think of, she had. And in her case, after knowing that her foundations were good, I started her on progesterone because, like I mentioned earlier, progesterone is oftentimes the first hormone that it goes deficient.
Sure.
And so I started her on progesterone, and very quickly her entire life changed. And she felt so much better. Her symptoms resolved, and it was really a change in her life, pretty much.
Mm.
And one that really the whole family experienced because when mom and the wife is doing so much better, then really the whole family feels it. And so
Right.
you have a happier person in the house. That then means your husband is doing better, your kids are doing better, right? So it has more an effect more than just the individual. So I share that story to say that there are instances in which hormone replacement therapy is very important. We just have to see where you are on your health journey and
Sure,
what you might
absolutely.
need.
Absolutely, and I've heard great stories about it, and also, I've also heard of plenty of people who will go straight for the therapy,
Mhm.
but not handle the foundation, and it
Yes.
becomes
Mhm.
cyclical, like, it doesn't seem to give them the results that they desire.
Yeah.
But I love that you said that kind of that ripple effect.
Mhm.
I feel like that there are so many women who will say, it's okay. Like, I can sacrifice me. I don't need
Right.
to, take care of my own personal health because everybody in the family needs to be taken care of first. Like, we're nourishers and we're the ones that guide others. And so I love that you talked about that because it truly does impact
Mhm.
everyone around you. And for those of you ladies that are watching right now and thinking, yeah, but it's just not important. Actually, it is.
Mhm.
It's incredibly important because of the impact that we all make, not just in our households, but let's talk about the workplace as well,
Right.
right?
Mhm.
So many individuals, we have these stressors, we have the lack of sleep, and but then we take it into the workplace with us as well. And many of us are high achievers and we want to do well, but then we have this block. So talk to us
Mhm.
about how the hormone deficiencies can affect us in the workplace.
Yeah, I mean, I think when it comes to if we're talking about women specifically, then women in places where their work is extremely important, they may have high positions. Um, if they're struggling through significant symptoms of mood swings and other things, then they're not going to be as effective and as optimal in their work environment. And that's going to then reflect in their interaction with their colleagues. And if they're a boss, then how they treat their subordinates and things. And so that's how you can have that ripple effect continue into the workplace outside of just the family. I think for men, I think that the same thing applies when they have hormone related issues, specifically low testosterone, let's say. Then how is that impacting their mood and their sense of self-worth and so many other things that are incredibly important in the workplace? So just like a happy, well-functioning woman in the workplace, I think the same thing applies for men. And so, people want to have their boss be a really good boss as much as possible. Now,
Sure.
it's not all hormonal. There's
Yeah.
a lot of psychology. There's just people have different personalities, right? So
Yeah.
sometimes you just can't get away from that. But for how much it is related to hormones, definitely we want to be in a place where everyone can be as sound in health as possible.
Mm.
And also workplace efficiency, when you think about, let's say you are a worker, an employee, and your health is just very poor. So every other day you're having to call out,
Sure.
you're having a bunch of symptoms, and now the company now struggles. Right.
Right.
And so,
Right. Yeah, I think thank you for pointing that out about the workplace. And aside from carrying your card around and giving it to workplace people and saying, "Here, when your boss turns to a jerk and they're used to being nice, give them my card,"
right.
right? Like, can't really do that. But we talked a little bit about the women's side, and I know
Mhm.
that's your primary area of focus and support right now. But let's talk a little bit about men's hormones as
Mhm.
well, because you mentioned
Yeah.
that. And I also think that, men are used to carrying the load. They're
Mhm.
used to saying, "Oh, just rub some dirt in it," like you know,
Right. Right.
right? Suck it up, right?
Right.
There's all kinds of stigmas that men carry that it's not good to go to the doctor. Well, it's also not great to live a suboptimal
Mhm.
life, right?
Yeah.
So talk to us about some of the symptoms that you start seeing
Mhm.
as men's hormones
Mhm.
change.
Absolutely. And I think that as a man, I think I can speak to that little ego that we have in our brain that tells us that we can handle most things on our own and don't need help. And I think that this is incredibly difficult for men when it comes to seeking help, whether it be in their physical health or their mental and emotional health.
Right.
I think when it comes to, just as a side, when it comes to mental and emotional health, it's even harder for men to say that, hey, I need to go see a therapist. I need to go to marriage counseling or couples counseling or something where they may feel, or maybe they've been told, that they're deficient in one aspect of their life, be it mental health, be it emotional health, their marriage, whatever that might be. Um, so that's that side part that is really important. But as it pertains to physical health, men, what's interesting is that my practice is primarily women, but I do see men, and the way that I often see men is after I've seen their wives,
Mm,
right? So a lot of times what happens is that women will seek me out as a practitioner, and then I will see them, and then they have a good experience. They feel better. They feel like they have someone that has listened to them. So then they'll drag their husbands in. I
sure.
need him to come see you. And I think that that's one of the beauty of having wives, that they are so perhaps more caring about the husband's health than he is himself. So they're really just dragging him in.
Mm,
And that's that point, they kind of sit down very begrudgingly, like, okay, I'm here. We'll see if this works, kind of thing.
sure.
But to your point, men can suffer from depression, low mood. They can have low libido. They can have erectile issues and sexual function issues,
Mm,
and motivation problems as they get into their middle age. When you think about their kind of visceral fat, that belly fat, that starts developing more. And a lot of this, although there are other hormones involved like thyroid and so on, a lot of this does happen as a result of testosterone.
mm,
So there is testosterone deficiency that we know progressively happens with time, that decline. Every year in a man's life, he's losing more and more testosterone. And if you add on to that a really poor lifestyle where he's not sleeping well, he's overweight, he has maybe sleep apnea, right? So he has a large neck and snores, and he has sleep apnea. All those things are going to drive your testosterone down further and further.
oh,
And so I think that the point is that there has to be that awareness that, okay, I'm not feeling right. I'm not feeling as optimal as I should be. Let me get my hormone levels checked. Let me get my blood work checked. It may not have anything to do with hormones. It could just be another deficiency of some sort: iron, vitamin D, thyroid, something else.
Mm.
Um, but uh, so then we're trying to get these men to be aware of their bodies, their symptoms, to get their levels tested, and then to talk about appropriate treatment.
Mhm.
And I think when you talk about men's hormone replacement, then there's a lot of misuse out there. We have to stress that. And now you have really a testosterone clinic at every corner, pretty
Mhm.
much, right? You've
Mhm.
probably seen a lot of those,
Sure, sure.
um, where you can make the argument that it's being used too much. So what I mean by that is, let's say, someone is completely normal in their testosterone, and there is this kind of health craze that is in our society as well. You have extremes. On one hand, you have the extreme that the man is not going to go in and get their blood work checked, and they're not caring about their health. The other is that you have these men that are highly focused on their health. They talk about longevity, and they want the latest peptide, and they want the latest, what can you give me to make me live longer and optimize my health. And I think that a balance has to be kept, right? So I'm not advocating for, if your testosterone levels are above normal and you're feeling fine, that you are then using testosterone to super boost those levels, right? So I'm not advocating for that. But at the same time, I think you can have a balanced approach that looks at health without the fear of these hormones, and using testosterone if a man is really struggling, and using it in the right way with a good practitioner. That's really important. So men's health is just as important as women's health as well.
Absolutely. And I think, as we start to get access to more and more information, I think what you said was spot on. And I think there's also this middle group right here that we tend to want to just, if TikTok says it, we're going to try it,
Right.
and that, let me tell you, I commonly refer to my house plants. I try not to refer to them too much because I often kill them. But house plants are so fragile, right? And they're a little ecosystem of how they're made, but they're beautiful. And our bodies, to me, are just like that ecosystem. They're so delicate, and yet we abuse them so much. Like, I was having a conversation with somebody the other day about our vehicles, and I'm like, a vehicle is, it used to say, okay, 150,000, and that's
Mhm.
probably 150,000 miles. And now
Mhm.
maybe we can get 200 out of it,
Right.
maybe.
Right.
But that's it.
Mhm.
And we're designed, scripturally, we're designed to live up to 120 years, and yet we will put garbage in us. Yeah. And so, and then we'll try to patchwork it together, and make this concoction or whatever. And so I feel like the solution is definitely specialty care,
Mhm.
individuals that understands the dynamics that we're walking through and the deficiencies that we may have in our health, and really being willing to submit to authority. And I think that that's something, I'm sure as a doctor, that that's something you would appreciate when people do, because what's necessary, and you have insight to things that they don't have access to. But talk to us, like, do you have any stories where maybe somebody like tried to be create their own concoction of health, and you've
Mm.
kind of had to coach them out of that?
Yes, absolutely. I have very interesting patients, and I think I've been blessed with very great patients, I would say. Patients that are open to your suggestions, and very patient, because, trying to get health improved takes time.
Right.
And sometimes, I think to myself that I might not myself have that same patience, but a lot of them do. Bless their heart that they have that type of patience where
Good.
you can try different things, um, and they have the patience to say, okay, let's see if this works. And so that, now there are patients on the other hand that have very rigid mindsets about stuff, whether it's about not taking a medication, whether it's about definitely taking a medication, or whether it's about something else. So from my standpoint, my job is really to try and assess that human being,
Mm.
because a lot of times I'm assessing their physical health when they're sitting in front of me, but I'm also understanding what that human being in front of me is all about. And once you know that, then you also understand what motivates them and what they're looking for, right? What patients are looking for is very rarely communicated by words. So in an interaction with them, I can often tell, just because of doing this for so long, um, I can often tell what is it that they're looking for. Do they just really need um, someone to listen to and they haven't had that?
Mm.
Or are they strictly focused on certain health parameters, markers, like I need my labs to look like this, or I need my symptoms to fully get better? You need to understand their expectations. Now, it really helps when I ask them that,
Sure.
but there are these subtle things that you have to pick up. So what I then have to do, a lot of times, like you mentioned, kind of coach them out of it. It's more so just first of all understanding them, and then gently taking them in the direction of what I feel is best,
Mm.
with the same time keeping the humility that a lot of times my patients might teach me,
That's
which
great.
is to say that I thought that this might work, and they come back and say, well, you know what, I've actually been doing this. I hope you don't mind, but I feel so much better.
Wow.
And now I've learned for that next patient that such a thing could potentially help. So I feel like it's a really a bi-directional relationship in terms of me giving them expertise, but then them also giving me a lot of experience.
That's a wonderful way to look at it. I really
Mhm.
appreciate that. And it reminds me of our previous conversation that we had when you talked a little bit about the difference of what you bring to the table
Mhm.
in your clinic setting
Yeah.
versus what you've experienced a lot of times in more corporate led
Mhm.
medical centers.
Yeah.
And do you feel like you've always had the flexibility to treat clients and patients the way that you're able to now?
I think when I started this practice, I definitely did. Before that, I felt I was very limited, especially in the hospital setting. And that's what led me to start the practice, is that I just kept seeing these patients that are suffering with a lot of chronic disease. But when they enter a hospital system, while their acute issue was taken care of, they weren't necessarily improving in terms of healing themselves and that long term health that we're looking for. And
Mhm.
so that's what drove me to create a model where I can actually have a relationship with patients over time and see their progress, and also not be burdened by the insurance model, and the so limited by my time that I can spend with them, limited by what tests I can get for them.
Mm.
Or in a corporate setting, like you mentioned, if you're working for a large, Ascension or one of these other large practices, then also limited by the administration, right? Because
Sure.
they'll tell you, you have to see 20 patients today, you have to see 25 patients today, you have 15 minutes with patients each, and that's it. So
Mm.
there's so many physicians, unfortunately, that just have so little control over their own practice in medicine. It's either dictated by an administrative person or an insurance company or a pharmaceutical company,
Mm.
and we get left with very little autonomy to actually practice good medicine. So
Yeah.
I'm very fortunate to be in a place where I can do that to a decent degree.
Well, I know your patients must be incredibly grateful because just sitting here and having this conversation with you, I can feel your heart towards your patients, and that's huge.
Yeah.
Yeah. I
Mhm.
think at the end of the day, we literally when we don't know something and we don't know what's happening in our bodies and we go to the doctor or we go
Mhm.
to the clinic or maybe we go to a telemed and we're literally putting as much out there as we know how to.
Right.
And we're truly just submitting that to the authority and hoping that they carry that same kind of
Yeah.
love and compassion that you have. And so it's great to
Mhm.
to see somebody out there doing that and being that because
Mhm.
tell you what, this is what we have, right?
Yeah, yeah, and I do on a daily basis feel that burden, whether it's a patient that's coming to the clinic and paying me there, or it's a patient in the hospital and I'm their physician. I do feel that burden to try and treat them as effectively as I can in order to get them better. Um, so a lot of times it works out, and sometimes it doesn't.
Mm.
But that's just the nature of healthcare,
Yeah,
unfortunately.
yeah. Well, if you could have a magic wand
Mhm.
and you could say all healthcare should look like this, what is it that gets your heart beating and gets you up every morning to work towards?
I think that if we have a similar model to what I've tried to implement in the practice, which is trying to be as compassionate a physician as possible, in a transparent healthcare model, from a pricing standpoint, where patients know exactly what they're paying
Mm.
and they're not paying artificially inflated rates on whether it's a lab or it's a medication or a um, uh, test or something like that, then I think that that's the most important thing, is to get good really compassionate practitioners, seeing patients, listening to them, right? I think a lot of people have just suffered from years and years of dismissal of symptoms. And so if we can do that, I think that that's the most important thing. And secondly, I think a lot of the fear around hormones, if we can get that dissipated a little bit more, where we're getting it out to the public, I hear it on a daily basis that, oh, I wasn't able to start on this hormone because of the risk of breast cancer or some other risk or something like that. Whereas we now understand that risk much, much better. And unfortunately, for the last 2 decades, that risk, whether you're talking about breast cancer or something else, has been completely filled with misinformation. And we're working to correct that, but it's just not happening fast enough, I would say. So we keep running into patients that have been suffering for so many years as a result of not being able to access really good healthcare in one form or the other. Either they couldn't afford it, or they just couldn't come across a good practitioner, or they were refused hormones, something like that. So hopefully it's an encouragement to patients that they can find better care, and also to providers to say that we, as providers, we need to step up our game, because, I see medicine very differently. I see the role of the physician in society as much higher than I think what we're making it out to be. I see physicians as really true leaders and people that have a trust that the public has built over centuries and centuries, that's the doctor. Unfortunately, we've eroded a lot of that trust with, big things in the past, like the pandemic and other, like just pharmaceuticals and all that has eroded to some degree the trust that the public has with a physician. But it's a very important relationship, and physicians are incredibly important in the society. The politicians aren't stepping up as leaders, or at least effective leaders. So when you talk about good moral leadership, it has to come from somewhere. And if that void isn't being filled by the politicians, which clearly it's not, then we really have to step up to that. So yeah, I think waving the wand would look like just better access to care for individuals with more effective and true guidance on hormones. And I think from a provider standpoint, for encouragement for providers to step up and really be that leader in society that we would like them to be.
Well, it starts with one. Oops. Yeah. It starts with one.
Yeah.
Right. And deciding to say, hey, if it is to be, it's up to me. Right. I commonly think of the Michael Jackson song, The Man in the Mirror. Right.
Right.
I'm going to be the one that takes that charge. And you are doing that one patient at a time, and, one ear at a time. As people hear this, hopefully they'll be compelled to say, okay, maybe I'm not a physician, but how can I be a better leader? How can I be a better leader in my household? Maybe it is starting to take better stewardship over my health, and making my husband go with me, or my partner, or whomever that is. Right. Maybe it's our leaders in the workplace, recognizing, as you said, when things start shifting in them. Hey, as a leader in this organization, it's important that I am most present and the best leader I can be, and that means taking care of me as well. Yeah. So I think you definitely spoke to leadership, even though it wasn't the topic, but it's your heart, and I think that really shined through today. So. Well, how can our guests connect with you and find you if they say, hey, I've experienced some of those symptoms?
So I have my website is www.medinamedicine.com. That's MADINA, medicine.com. And that has all the information on kind of what I do and where we're located, the phone number, email, so they can reach out there. I'm also on social media, so Instagram, YouTube. I try to, as often as I can, post there just good information. Sure. That's often a little hard to keep up with, but I do my best. So those are generally the places to connect with me.
Fantastic. Well, thank you for the work that you do, and thank you for your compassion. Compassion is something I think we're missing in the world. And so leadership and compassion, those are two things I guess are probably very big values of yours, but they came across today.
Absolutely. Thanks so much for having me. I really appreciate the work that you're doing.
Thank you. My pleasure. Well, friends, thank you for joining us today. What an awesome conversation. And maybe you found yourself looking at some different symptoms or maybe started saying, this doesn't really feel like me. I would encourage you to go back and listen to the beginning part of this episode again. Start listening to those symptoms, listen to your body. And of course, as was mentioned today, those four core pillars of nutrition, of sleep, of stress, and of movement. And let that be part of your daily lives. But friends, you and you alone have the power to be the steward over your health. And Unbreakable Health is here to partner with you by bringing expert physicians that truly have a heart of compassion and leadership, as we saw represented today. So, thank you for watching. Until we see you next time, continue building your unbreakable health.